Hi, and once again, welcome to Georgia Medical Academy's online AMT course. We'll be going over a continuation of Chapter 1, and in this section, we're going to talk about regulation, which includes legislation of EMS as well, and evaluation. And I'm going to talk about evaluation of not only the EMS agency or the system in which you work, but also personal evaluation a little bit. So first, let's look at overall regulation. The state, and you've heard me say this before, has the authority to regulate EMS. Most states have established a state agency. Here in Georgia, we have the State Office of EMS, who regulate and enforce the laws and regulations associated with EMS. Every 2 years, that's whenever you purchase a license, that's part of the regulatory process that the State Office of EMS has to ensure that the personnel working in the field are properly licensed and credentialed to do so. So the State Office of EMS follows state legislation. And under the state legislation, what the legislature, the state, the Senate, and the House of Representatives and the governor's office, whenever they sign into a law, that law is then applied towards our EMS system throughout the state. The state office of EMS has to take that law and use that law and make rules and regulations and develop ways to enforce those rules and regulations as well. That's on the state level. Now, on the local level, you have your medical directors, you have your operations directors, your CEOs, and whatnot of the organization in which you work in, who take those regulations and the rules that are established by the State Office of EMS and develop operating procedures. Your medical director, along with other people in the service, at least other people in the service should be involved. Hopefully the service you work for has a good working relationship with your medical director, and your medical director gets together and sits down and establishes protocols and standing orders that will apply to your scope of practice and what you do every day in the field. Hopefully your medical director is not just a lone entity doing this, because they may not understand all the aspects of EMS and how we deliver care in the field, because they may not have done that before, and they need your insight because you will be an expert. And AEMTs and paramedics out there are the experts in delivering the care to the patient side. Now, the physician is the expert and the authority in the medical care being provided, but it's totally different starting an IV and doing CPR in someone's bathroom versus doing it in a trauma room. So that input is very important so that they can develop protocols and standing orders that will be effective in fulfilling the mission of the service. Usually, the places I've worked at, you have the medical director, and you'll have other people who are involved, a supervisor, people from training, people from dispatch. You'll have people from the field, which include paramedics and EMTs as well, that will get together and work on protocols. Because even though a part of a protocol may not apply to an EMT because it's a paramedic skill, that EMT is still there assisting, and that input is very important. Now, most of our services are usually administered by senior EMS officials, but let me tell you, it does not take long for a paramedic to become senior. I've seen operations managers that have been in the field for less than 5 years, and I've seen many supervisors less than 3 years, and sometimes you will find EMS instructors that have been doing it less than 2 years. Experience is very important. It's something that you have to fall back on to help you make decisions, but it's not always there. So if you want to aspire, you can. But having experience is very important. And most of the time, if you see in the large services, they are very senior officials that have fallen into that post due to the fact that they have been working for that service or in the field for a very long time, and they have proven themselves, and they have the credentials, the education, and whatnot behind them to elevate them to that level. It's not easy being a senior administrator. It's easy for us to sit in the field and getting hammered all day, thinking that the operations manager's having an easy day, but they don't, because our day ends. And let me tell you, from experience, their day never ends, and they have a lot on their plate. So, well, with that said, and getting off the soapbox, they are the ones who help coordinate and administer the policies and procedures that are established from all this interpretation of legislation that comes down. And they also make rules and expect you to follow them, and they enforce the rules there too. So, the medical director's role in evaluating. Evaluation is very important for any system. The medical director and training officers and operation officers and supervisors and field personnel, dispatch personnel, and even sometimes people from the public need to be involved in the evaluation of the system. We sometimes call this evaluation component CQI, which is Continuous Quality Improvement, or QA, which is Quality Assurance. Now, CQI or QI and QA, what they do is they review and audit our runs. And what they're doing is they're looking for trends. They're looking for things that we could do to improve the system. For instance, I remember a project way back when that was very, very beneficial. It's when aspirin, when they had just come out and said, hey, aspirin is this golden drug that is doing everything, and we know how beneficial now aspirin is, but for the longest time it was not a big deal for us. We didn't administer aspirin like we should have because it hadn't been pushed. So to make that push, QI came down and came up with a project, and they measured to see where we were at. How many times were we administering aspirin on these chest pain patients? And how many times should we be administering them? Pretty much almost 100% of the time. So what they did is they found a baseline where we were at, and what they found is that less than 50% of our patients were getting aspirin, period. And we had to improve that. So to improve that, we set goals and we had training, because apparently we needed some training. And if you can see there, CQI is also part of helping us develop appropriate training that will make patient care better in the field. And having this course where we learn the benefits of aspirin administration as early as possible and how it can help our patients recover from an MI was very important. It got everyone on board. We all saw that, man, we're doing a crappy job at administering this drug that can really make a difference. And we all got on board, and we went, and you could see every week they were posting bar graphs to see our progress improve. And we wanted to improve to 100% of those eligible to take the medication. You know, not every patient is eligible for, aspirin. There are some contraindications. So if there was a contraindication there, it was, they were put out. But if there was a contraindication, it was important for us to document that there was a contraindication. So that was very helpful, because us documenting that contraindication meant that that information was passed on to the other staff that was taking care of the patient. So this process improved the way we delivered care to our patients in the field. It was not punitive at all, and it should not be punitive unless something's found where someone is just grossly negligent. Well, then you have to do something. But majority of the times it's not. For instance, another example is transporting patients to the appropriate facility, like a level 1 trauma center. That is from us learning information from CQI, knowing that it's better to bypass a local hospital and get them to a facility where they can get definitive care quicker is something that we learned from CQI. CQI is very, very, very beneficial, and you should participate 100% in this. Also, like I touched on, our refresher training and any continuing education comes from CQI, and it's very important for us to utilize this as a tool because our skills can decay over time. There's skills we don't use, especially the pediatric skills. We don't use them enough, and if you don't use it, you will lose it. And it's very, very beneficial for you to attend your continuing education on a regular basis. So like I said before, eliminating errors and improving patient care are our goals. So one thing you need to understand is what is the main source of errors, and most of the time we found it's human error. So how do we prevent that? Well, we continue to study. We continue to take continuing education classes. We receive input from others around us and not be so defensive whenever someone tells us we could do something better. Be aware of your environment. Injuries happen all the time because we slip and fall, or that we're in a hostile situation before we know it. Handing off patients is a high-risk activity, so you want to be careful whenever you're moving patients from stretcher to stretcher, and you want to make sure you give an appropriate patient care report and make sure someone knows and has taken over care that is appropriately trained and able to take care of that patient. So when we're about to perform skills, it's important to ask, why are we doing this? Are we doing it for the patient's benefit? Because everything we do should be done to benefit the patient, not for our convenience. Use cheat sheets whenever you can. The EMS Field Guide, I've used it for years, and I'm proud to use it. I will go to my protocol book very quickly. I am not afraid to utilize my protocol book to double check drug dosages or proper procedures, and you shouldn't either. There's nothing wrong with it. When I used to fly for Emory Flight, I used to sit down and I would write out my drug dosages before I got on scene so that I knew exactly what I needed to do. Use downtime to refresh your infrequently used skills. I cannot emphasize this enough. You need to take this time and utilize your downtime as much as possible to practice inserting a combi tube or King Airway, of doing an interosseous infusion, especially on a pediatric child. So how often do you do those on pediatrics? We need to use our time as wisely as possible. And discuss troublesome calls with your partner. You and your partner need to work together as a team. And the better you can work together, the better patient care you can provide to them. Well, that concludes this part of our lecture. We've got just a few more parts to go before we're finished with this chapter. And once again, as always, if anytime you have any questions, please contact me and I'll be glad to help clarify anything that we've gone over.